guys, welcome back to Medical Coding with Blue. Today's episode is all about the questions you should ask yourself before pursuing a career in medical coding or something else. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so I got this comment on the video that I did, what do medical coders learn before medical coding? And then tips, for learning. But this person wrote, I will be starting college soon and plan to major in medical coding. But a part of me says major in sonography, right? To be a sonographer, right? I don't know what to do. I see myself in the medical field. I love the idea that coders can work from home. Of course you do. Of course you do. But I really like what sonographers make an hour too. I feel stuck in big letters. And I told this person that they are not in fact stuck, okay? Whatever career field you're looking at, if you are looking at that career field based on the amount of money that you're going to make, and that's the reason that you want to pursue it, you are pursuing it for the wrong reason, and you will be miserable. Now, there's some people that want to do certain career fields and they really like it, and the money is just a bonus. And yes, we all have to get paid for the things that we do. Medical coders get paid very well. Okay, I've said that many times. I do not talk about what coders make in specifics on my channel. Never have, never will, because there's a lot of people that will sell the career field of medical coding to people based on the salary that coders can make. And what happens is it attracts a lot of people, and then some people just stay with it and they're miserable because they don't actually enjoy the coding. And then they like the money, but even then some of them will feel like it's not even enough for them not really enjoying what they're doing. So some of the things that you need to ask yourself is this: what kind of investment do you want to do into the career that you want to pursue? Whether it is that you want to pursue a career field in medical coding or something else, being a sonographer, you have to think about this. Both of them are going to require lots of study because you have to learn medical terminology, anatomy, pathophysiology, and a lot of other things. And there's rules and there's regulations. And with coding, we're not interacting with patients. We are only interacting with our healthcare providers that we are coding for. But on the sonographer side, or anything having to do with patient care, you're dealing with the patients. And not only that, as a sonographer, you have to physically move the patient. You have to physically touch the patient. So if that's not something that you're comfortable with, you need to think about that, because it's not just one type of person. It is all people that you would have to be working with. So if you have some kind of issue as far as maybe you have arthritis or something, or you can't move, you don't have flexibility and that kind of thing, that's a problem. Or if maybe you're a very shy person and you don't like talking to people a lot, being a sonographer is not going to be for you either, because you have to be able to work with all kinds of people. With coders can be shy, they can be quiet, and that's totally fine because that's conducive to their work. It's not, it doesn't take a lot of talking sometimes when you're working on these charts, obviously. But if you are talking to providers, that's when you will have to do some communication. And a lot of people will get hung up in their own head about, well, I'm a shy person and I can't. And they never really give themselves a chance. They're just looking for excuses. I'm about giving y'all the truth, because to me, there is no time to waste. There is a very limited time that everybody is here on this earth. Your trip around the sun, however many times it is in this lifetime, has an expiration date. Everybody does, okay? But the thing is, you have to decide how you're going to spend your time and what are you going to do. If you spend your time and chasing money and chasing that next bag and chasing all of these other things, oh, I can work at home. Working at home should be an afterthought for you. It should be a side benefit of what you're doing. I have always said on my channel that new medical coders should never work at home first time out of the gate. I don't care if you get upset with me saying that. The reason that I say this is because you need time with other coders when you're first starting. Yes, I know for some that maybe in their area, there's not a lot of room for the coders in the facility, so they are at home. That's not something that they can control. That's something that is different. However, you're still missing out. And for those of you that started in 2020 when we were all going through that, some people started in 2020 and said, well, Blue, I've been a remote coder ever since then, and I'm not missing out on anything. Yeah, you are. I guarantee you that you are, because you don't know what you don't know. And that's the problem, is that people don't know what they don't know. You don't know some of these things. You don't know some of the tricks or some of the things that would make your job easier, because you're not around other veteran coders to kind of coach you and help you and mentor you along. There's only so much connection that we can have through a screen. It is very difficult to connect with people sometimes via a screen and just, having, Zoom sessions or whatever. It's different when you're in person. There's nothing wrong with being in person. There's nothing wrong with working at home. But I have always had the very firm stance that new medical coders should spend some time around other coders when they very first start. So if that's the reason, again, that you're going to pursue this, you're going to set yourself up for failure, because book coding and real world coding are two different things. In the book, and anything that you're learning while you're learning medical coding is going to be textbook. It is going to be accurate. It's going to give you all of the information. Whereas when you get out in the real world, it's a whole different ballgame. It's not going to be like the book. There's going to be providers who are going to document whatever way they feel like it, because they're human too. So that's something that you have to consider. And then on top of that, everybody uses a different electronic health record. It's the same thing for people who want to go into sonography. You're going to use different software systems, different computer systems, different electronic health record systems. You're going to use all those things, and you have to learn that as well. So it's not just learning how to see things or take pictures, being a sonographer. It's also about your documentation and all of the things that you're doing. And again, working with patients who are not well, patients who do not want to cooperate, patients who are scared, patients who panic. There's a lot of things that go into being in that direct one-on-one patient care. And that's not for a lot of people. It takes a special person to work with patients and work with all different kinds of personalities. So again, if you're just looking at it because, ooh, I like what they make an hour, there's all those other things that you have to consider before saying that this is really what I want to spend time on and do. Okay? So again, I don't like to see people chase any line of work just based on the money. I understand it's a survival thing, and there's a lot of things that people have to go through in life, but one of the things that you should consider when you are picking a career field is how much time are you willing to invest in learning. Again, sonographers, you have to keep up with continuing education units just like medical coders do. Okay, just like medical coders do. And we have to constantly be with those updates, and we have to constantly learn and do all of these things. So it depends, and it's all up to you and what you're able to stomach as far as like how much grit do you have. And then when you're getting out there in the real world trying to find your first job, I don't know how quickly sonographers get hired. Maybe they get hired fast, maybe they don't. It really all depends. Think about it. The sonographer is the one that is going to be taking these pictures that are going to be interpreted by somebody else, and these pictures have to be right. They have to be clear. If you're taking pictures that are all over the place and blurry and not where it's supposed to be anatomically, that's an issue, because again, you're affecting patient care. If you're not taking pictures of the right anatomical locations and you can't open up the patient, I mean that could be a problem, because you didn't put the picture where it was supposed to be, and that can cause a lot of discomfort for that patient. And again, you're getting hollered at, by that patient. So there's all those things to consider. But again, if you're just going to chase it just for the money, you're chasing it for the wrong reasons. It's the same thing with coding. If you're chasing it for the money, again, wrong reasons. You want to work at home, I don't know what this fascination is that everybody thinks it's the greatest thing in the world to work at home. It's not, okay? For some people, oh, they love it and it's the best thing. But a lot of people are losing their social skills, and I see this every single day because everything is online. I mean, you want to send an email, you want to chat with somebody, you can do it all online. Everything is online. And there's the human connection is getting less and less and less. And I'm always going to rail against that because I believe in human connection. I don't think that it's good to always be at home, always be in your own environment. You still have to have that social connection with people, and especially in a field like medical coding. And when you don't know what you're doing in the beginning, it's going to be very difficult for you. And for my nurses, I got a questionable, I'll just say questionable message from one of these nurses that told me, well, I've been doing this for 30 years and this is not going to be that hard. Medical coding. Okay. Okay, go ahead. Go ahead. As I've said, when it comes to this career field, I will never question anybody's intelligence as far as like the experience that they've come in with. But I will say that even doctors don't understand what we do. And you can break it down to the simplest terms and they're still not going to understand you sometimes because it's a lot and it's very confusing and there's so much to it. And again, all the updates. So there's a lot of other things that people don't consider, and it's not until they get into it that they're going to understand it. Some people have to learn the hard way. That's all there is to it. You know, again, I'm trying to make this video to help some of you avoid the hard way. The questions you need to ask yourself when you're trying to pick a career field is, what are you going to be excited about? Do you like the activity that most of that job entails? Like for us as coders, as medical coders, we read 90% of the day. 90% of the day we are reading. If you are not a reader, you do not like to read, this is not going to be the field for you. It requires very good comprehension skills. Very good writing skills is a plus, because you're going to have written communication with some of these providers as well. And there's nothing worse than somebody who puts together a terrible message because they don't like to write. And I've heard of that too. Well, I don't like to write. I don't like to read. What are you doing in this career field? Again, trying to chase it for the money. So sonographers, you have to be very physical. You have to be hands-on. You have to have some level of strength. You can't be, just not being able to physically move things around. You have to be able to do that. And it takes somebody that's going to be not just skilled with doing sonography, but also being able to talk to patients and make them feel comfortable. Is that something that you're going to be comfortable with? Think about that. It's not just about the money. It's like when I get messages from people who say, well, Blue, I wanted to be a nurse, but I got into the program and I decided that's what's not for me, because you were looking at it for the money. And then you didn't realize that there's math involved in nursing. There's being with the patients, obviously, but not just the patients, the doctors as well, and the other healthcare providers as well. So there's all these other extra components that, again, people don't think about. They want to think about the money, the money, the money. If y'all stop thinking about the money and you start focusing on, this is a good paying career field, let me just get educated. Let me just make sure that I understand what the heck I'm doing, so that way I can be a better sonographer. I can be a better medical coder. All right. There are some nurses that say, Blue, I'm in nursing school and I'm going to do nursing school and I'm going to do medical coding on the side. So I'm trying to learn both at the same time. No, ma'am. No, ma'am. No, sir. You need to learn one thing at a time. And again, not something that I'm doing to question your intelligence, but you need to be able to focus your attention on one thing, learning one subject, whether it's nursing or whether it's coding or whether it's sonography, because that's going to make you be a more competent person in that field. It is hard to start in any career field, but it's even harder if you're not competent. I'm just saying. So with that said, and look at the amount of money that you're going to be willing to invest. Yes, maybe you may not have any money right now, but if you are not willing to continue to invest in yourself as far as learning goes, as far as reporting your continuing education units, because sonographers have to have that, medical coders have to have that. Any intellectual field you get into is going to require you to have continuing education units. And for some, you may have to pay. You may be able to find some for free, but you should not be relying on free CEUs all of the time. There's people that say, oh, well, does anybody know where I can find the free CEUs? If you're asking people to spoon feed you that information and you're not doing your research, that again, that's somebody that needs everything handed to them. And that's not this field either. That's not sonography either. You've got to be able to learn to do your research, because there's so much out there that can help you. If you're not doing that, you're setting yourself up to fail. Okay? And you want to pick something that you're going to enjoy. If you are a people person, look at a career field that's going to require you to use those skills, to be around people and things like that. But if you get overly emotional, or if you get overly attached in situations, maybe there's certain career fields you should not be pursuing, like social work. If you are the type of person that everything breaks your heart, you get so emotionally attached to something, you should not be pursuing social work, because while your heart is in the right place and while you have all of these ambitions and goals to want to help people, if you can't keep your emotions in check, you will be no good to those other people, because you will wear yourself out. You will wear yourself out. And that's the other thing too, is that if you are going to pursue a field and you are just overdoing it. And we all know when we get to a point where we start to overdo things. And if you can't get yourself in check and you can't get yourself to be right back on track, you're going to lose everything that you started to learn and all that invested time, because it takes time and it takes money and it takes energy to be able to get through these things. When I was in coding school, and I went to a trade school, and it was all self-directed. They put me in front of a computer and said, here, learn. hit that go button and go. That was what I did. But every single time I passed a course, I got my next set of books. Now, I am a reader and I'm motivated by books. So for me, this was a very good fit. People talk about the puzzle. It is a puzzle. But again, if you're not a reader, it's going to be miserable for you, because you're doing something that you don't enjoy all day long. I love to read. And I started off as a slow reader because I enjoy immersing myself in the story. But as time goes on, you will start to get faster with reading. And everything is going to build itself over time. So you don't have to worry about learning the stuff overnight. It's just going to take time to get there. And as long as you're committed to those building blocks of time and learning and investing your energy and your time and your money into this career field, then you're going to be fine. I have been going to conferences for medical coding since 2014. I have missed only a handful of conferences. Now, of course, when the pandemic hit, I didn't attend, and it wasn't until last year that I had attended my first conference since the pandemic, which was nice, because I enjoy going to conference, because that helps me to get more educated. I pick up best practices from other people that I didn't even think of that has helped me. And there's a huge difference in my ability to do things and my ability to be able to catch on to things, I've noticed, than other people who don't do this same thing. Because again, they're just kind of stuck in this, oh, is that what we're supposed to do? There's a difference in the coder that invests time and money and energy into learning more and going to these experiences like these conferences, because it does make a difference. And it does get you excited and inspired. I am always inspired every time I leave conference. I am excited to go to conference this year. Of course, if you haven't heard, I'm speaking this year at the 2024 American Health Information Management Association National Global Conference that is happening in Salt Lake City in just a few days. So I am very excited to be partaking in that, and I can't wait. But with that said, all of the time that I've invested in learning, now that I'm going to be sharing my best practices, that's going to help other people. And I know it is, because again, sharing things that I know in order to advance other people. And that's what it's about. You know, as you get through your career, as you're going through and you're growing, you're going to get to a point where you have a lot of knowledge that you can share and give back to the industry, instead of just constantly taking from the industry. Like, what can I get? What can I get? What can I get? Remote coding, staying at home and doing my own things, set my own schedule. And a lot of times it's not like that. You know, you still have to adhere to the times that the facility or the organization needs you to be online, because it's going to be at the convenience of the provider. If the providers need a coder there, you're not going to be able to work in the evening time, third shift. Oh, I can work during the night and then I can get up and work during. What are you doing? You may as well just sell things online if you're going to do that. You know, if you want to work your own hours, do not pursue something like medical coding, because again, it's going to require you to have to exercise those communication skills. And if you don't have them, then you have to work on them. It's not an excuse because you don't like it. Communication, reading, that's big in coding. And it will get you far if you enjoy both of those. And if you don't enjoy communicating with others, you get very shy. That shyness will go away as you develop your skill, because for a lot of people, when they develop their skill, it gets them excited about whatever the subject is, and then they can start to share. All of that shyness falls away. Okay, so even if you consider yourself a shy person, if you know that you love to read, that you can comprehend documentation well, then you're going to do just fine. Everything else will fall into place. Your communication skills will better, and all of these things, as long as you are investing that time to getting better. But again, chasing a career for the money, you will always be miserable. You will never be satisfied. I have seen in my 6 years of having my YouTube channel, I have seen many people do that, where they are chasing the money, constantly chasing the money. And I had one fella that he was chasing money. And while he was getting really good and better with his craft, he just was never satisfied. And if you're never satisfied, then how can you truly be fully happy with what you're doing if you're never truly satisfied? You know, that's the thing that you guys got to think about. And this life goes quick. I mean, you get one rodeo, and before people try to correct me, one rodeo means one lifetime. Not you get to start and restart again. Because some of you act like this is a dress rehearsal. Life is not a dress rehearsal. If you do not have the ability to be able to keep your emotions in check, to be able to control yourself and get into studying even when you don't feel like it, if you can't get yourself there, that's going to be an issue. You're going to always start and stop things, okay? Nothing is going to be easy for you in this career field. This career field in medical coding, if you choose to go this way, is not going to be handed to you. I don't know anything about sonography as far as how easy it is to get in, but there's people that have a hard time getting in, because again, trying to chase money, have their mind preoccupied with money and not with, okay, how can I present myself well? How can I show my skills so that somebody can give me a chance? I saw a post today on LinkedIn where somebody was threatening to stop looking for a job because she can't get a job. She's had her CPCA for 2 years, and she says she's revamped her resume several times, and you know, she's just not getting any connections. Well, there's something that you're doing then. That means that you're probably only applying for entry-level positions when you should be applying for every single position that is asking for a medical coder, even if they're asking for experience. Because the default is 3 to 5 years. Everybody says 3 to 5 years because nobody wants to train. No organizations want to train. You may get very lucky and see somebody say, well, yes, we do train. We do give people a chance and that kind of thing. And again, you may be very lucky for that. But at the same time, what are you going to start at? And how are they going to treat you? And what are you going to be doing? So there's all those variables. But if you look past that, if you look past we're looking for entry level, get that off your plate. You start looking at these jobs that say we want 3 to 5 years experience, and the coder must know X, Y, and Z. If you have a really good resume, it's 1 page and a cover letter, and you send it to them and they get really desperate, they will call you. I find it impossible to believe that somebody could be applying for jobs intentionally for 2 years and hardly ever get responses. Something's wrong. Or you're applying for positions that are remote. It's getting harder for new coders to get remote jobs because people are going back to the office. If that's not you and that's not what you want, blah, blah, blah. I mean, again, I'm trying to help you guys set yourself up for success. I'm telling you the possibilities of why you're probably not getting those calls. And again, if you're not displaying your skills on your resume that are transferable regardless of the industry that you're coming from, that's also an issue too, because that goes back to having really good communication skills. And even if you've been working at the Dollar Tree or the Dollar General or something like that, there's that you took inventory, there's that you can follow OSHA. Those OSHA is regulations. So if you can follow regulations, that means that you can follow the regulations and the guidelines for coding as well. So that tells me that's somebody that's okay, they can do inventory. So that means they know numbers and letters. You know numbers and letters. You're not going to transpose numbers and letters when you see them on codes, because codes are alphanumeric. There's letters and there's numbers in some of these codes. So that's the thing. You have to think about those things when you are getting into the career field or whatever career field that you want to pick. My channel has over 1,300 videos where I talk about this career field, more than all the other things that I talk about as far as like coding wise. Because when I do coding things on this channel, people just don't watch. I don't know why. Y'all ask me for it, y'all beg me for it, I do it, and then it just falls flat. But I do some kind of video like this, or I do like tips about the interview process, boom, I got views. So I'm just trying to give you guys what you want. I'm just saying. So anyway, with that said, whatever career field that you pick it based on what you enjoy doing. If you do not enjoy reading, if comprehension is not your thing, do not pursue this. Do not pursue coding, because that's all this is. Again, I have to say this because people have said, is there a lot of reading involved? Yes, there is. It's more than just entering in codes. And even though they say, oh, the doctor selects a code, so all you have to do is push them on through. Doctors are not designed to be medical coders. They're not. And it's a good thing, right? Because that's why we have a job. That's why we have jobs. So keep that in mind when you're out there picking your career field, whatever you want to do. But pick something and stay with it. Stay with it and see it all the way through when you get your certification, and see it all the way through when you get your first job. Keep seeing it through. Get that experience in, so that way you can fully decide after that, well, if this was really not what you wanted to do, then by all means go ahead and change it. But don't get so discouraged in the beginning. If you get really discouraged easily, this will discourage you fast if you let it. Coding will. Coding will discourage you fast if you let it. But if you don't let it, and if you just, as many times as you get knocked down, you get right back up, you're going to be so strong and so powerful as a coder. And that's something that we need in this industry. We need strong coders. We don't need people who just follow just to go along to get along. or people who don't know how to do their research. We need people who know how to do their research. I'm just saying. With that said, best of luck to you in your career choice. I'm going to wrap this one up. If this video helped you, please like, subscribe, and share. And I'll see y'all again. Bye.